Thanks, Ryan. In this morning's Be Healthy report, keeping your heart healthy while battling cancer. You may not know this, but patients who undergo chemotherapy or radiation are at an increased risk for developing heart disease. Joining us now is Dr. Bruce Liang, director of the Calhoun Cardiology Center at the UConn Health Center. And why is it that we see this problem and this correlation between the cancer treatments and heart disease?
Because the chemotherapy and the radiation, one or the other, causes damage to the heart. And many times we don't really understand which patient is at increased risk for developing heart disease. So we team up with the cancer specialist, the cardiologist, and the oncologist, and work together as a team to help patients dealing with this problem. On the one hand, you're treating a serious condition like cancer. On the other hand, you're creating a second problem, that's heart disease. Many people may not realize that heart disease is the main cause for death and morbidity in patients who survive cancer. So cancer survivors, we got to work with the oncologist to deal with the sequelae of their treatment for the cancer.
And what can they do? Are there tests that they can go through to make sure that their heart's not being affected?
Well, that's an excellent question. So many times our routine testing for heart function is not sufficient. So we're working at the frontier of discovering new imaging tests or blood tests that can identify these patients who are at increased risk, so that we could intervene early by giving them a drug or a therapy that can protect them against developing heart failure. And that's what we do. And the other thing is that it might allow us to continue the cancer therapy if we can give them a medication that will protect the heart at the same time. So we can shield the heart from the harm of the cancer drug, for example.
And do patients simply ask their doctor to perform these different types of tests? Is it something that you should approach your doctor about?
Absolutely. It's something that this awareness needs to be better made among the patients and the doctors. Many doctors may not realize this, so I think it's very important.
Well, Dr. Liang, thank you so much for being with us and telling us this important news for so many people that have cancer and have to deal with this heart disease now. Thank you very much.
Thank you, Amanda.